Good morning, YouTube family and friends. Hope you had a great week. My week was okay. It was okay. Yeah, another week of work. Okay, today is Saturday, March 8th, 2025. And this is the big 5 0. Here we go. Do it this way 5-0 results. Week 50 results of being back on Mounjaro while dealing with a host of medical issues. Just a quick recap of my medical issues. I was diagnosed in July of 2024 with an autoimmune disease, generalized myasthenia gravis, which is a nerve. Well, it's where your autoimmune system is haywire, and I believe it's producing too many antibodies, which is either blocking the receptors that receive the signals from the nerve for the muscle to move, or it's destroying the receptors. In either case, I have muscle fatigue. Yeah, it's a pain. I also have liver cirrhosis, which I was diagnosed with about 6 years ago. That stemmed from non-alcoholic fatty liver disease. I always throw that in there. It's non-alcoholic. It's not caused from alcohol. I was never a drinker. So I eat fat. uh, that has also resulted in enlarged spleen and small varices in my esophagus. I also have severe sleep apnea, and I also have bladder issues and sometimes kidney issues. Sometimes I have fluid buildup in the kidneys. So who knows if that's all related to the liver cirrhosis or to the autoimmune disease. Who knows at this point? It's just a hodgepodge of medical issues. So, and unfortunately, once you have one autoimmune disease, it can easily lead to another. So, we're on the lookout. Hopefully, I won't develop anything else. And of course, with the liver cirrhosis, now it can easily turn into cancer, or the scarring that's on my liver, it can easily turn into cancer. So, every 6 months, I get an ultrasound. My next one is due next month. I'll get my 6 month ultrasound next month. So, we'll see where that's at then. Uh, Update: the surgery as of now is a go. Again, surgery to implant the Inspire sleep device. It's like a stimulator to replace this ugly CPAP machine. I hate CPAP with a passion. That surgery is on March 19th. Neurologist was a go. He just says I have to have right before the surgery, they'll do an evaluation on me to see if I need a dose of steroid, because it's not my habitual steroid user now because of the autoimmune disease. So they're slowly weaning me off of it, but I'm still on it as of now. So and the surgery can be stressful, going under anesthesia, and the stuff that they use to bring you out of anesthesia can trigger a myasthenic crisis. So they'll have to evaluate me right before the surgery to see if they need to dose me up with a steroid to be cautious. So, but yeah, I have my physical with my primary care provider on Monday the 10th. And so she's the last obstacle. As y'all know, I had a wound on my leg from my cruise. It was like a pimple or clogged pore that turned that I don't know if it got. I don't think it got infected, but it's taking a while for it to heal. So here's what it looks like now. Looks like it's healing up pretty well. As you can see, it's looking pretty good. In my point of view, it looks looking pretty good. I stopped using peroxide about 5 days ago per the nurse's instructions. I guess not. Peroxide will also kill good skin, so it can make it harder for a wound to heal. So they said don't use peroxide on it. So I stopped using it and just went with Neosporin. So I've been putting Neosporin on it every day, and it's looking a lot better. But you know, The primary care provider will look at it on Monday to be sure that it's okay. I'm over the flu from the cruise as well. This was a fun cruise for medical issues, but I'm still have a little cough every once in a while, trying to cough the phlegm up. So I'm wondering if I got bronchitis. I think I got bronchitis out of it because I'm still every once in a while trying to hack up phlegm from my lungs. So every once in a while, when I take a breath in, I get that little twingly or like a like an airways kind of rumbling. I forget what it's called. But every once in a while, I feel like when I get that, I try to cough off the phlegm, and nothing comes out. It's like a solid cough. So I still got some of the phlegm going on. So hopefully that doesn't stop me from having the surgery either. So we'll see. It's been a couple of weeks now. So, and I know when you have the flu, to fully recover from the flu, it usually takes a week or two. So it's been a few weeks now. So hopefully that's okay, and it won't stop me from getting the procedure. Again, just a quick recap what the procedure is. It's a device that like a pacemaker. Pacemaker goes on your left side. This goes in your right side. So they'll make a what the video I saw on YouTube of it is kind of neat. They'll make an incision first right under your jawline right here, and they'll dig down and get to like the nerves of the tongue or the muscles of the tongue. I can't remember which. And then they'll take like a pad and wrap it around they'll isolate the one that triggers your tongue to move forward. So like that. That's responsible for moving the tongue forward. And they'll wrap it around this pad, like an electric shock pad that has a wire attached to it. And they'll feed the wire down your neck into the port, or not the port, the machine, the device that they'll implant underneath your skin, on top of your muscle, like they do with the pacemaker. And it connects to that. And then there's a second wire that's connected to this that will run down under your breast, and then they'll plug it in between your ribs. So go through a couple ribs, or one rib, no, go in between rib. That's going to be painful. And it's like a monitor. So when you turn it on at night, when you go to bed, it senses when you take a breath in. So when you take a breath in, the device will signal to stimulate it to move the tongue forward. So every time you breathe in, your tongue will move forward while you sleep. That prevents the tongue from falling back and blocking your airway. And I had to do a study. I had to go, they did a little medical, they put me under to see how my airway gets blocked when I sleep. And that's how you qualify for it. One of the things you had to do to see you qualify, and I did qualify for that. My tongue collapses into the airway, and that's what causes my sleep apnea. This device can be helpful for that because it'll trigger whenever you breathe in, the signal will stimulate that nerve or muscle to move your tongue forward to keep it from collapsing into your airway when you breathe in. So that's what the surgery is. It's a neat surgery. So if you ever want to look on YouTube, just search for Inspire sleep apnea device, and you'll find it out there. It's an interesting surgery. So, but again, with my autoimmune disease, going under anesthesia is a risk. Hopefully, it doesn't trigger a myasthenic crisis where my muscles get too weak and I can't breathe on my own, because the diaphragm is a voluntary muscle, and this autoimmune disease affects all your voluntary muscles. It can make them weak because the signals get blocked. Does the antibodies plug the receptors of the muscles that receive the signal from the nerves, or it destroys them? There's a little. I breathed in that time. I could feel the rumbling. So it makes me want to cough and try to clear it out. So, but anyway, that's the update on that. So we'll see what the primary doctor. She's going to do some blood work, of course, because it's time for my A1C check anyway, and she'll want to check my cholesterol levels, because she took me off the statin like 3 months or so ago, and we'll see where that's actually, because there's been studies now that show the statins can also cause flare-ups of people with autoimmune disease. with the generalized myasthenia gravis, or just myasthenia gravis in general. So she's testing it. I haven't seen any difference from being off the statin, but I was never on a high dose of statin anyway. But she's going to want to see. Last time I tried to get off of statin, my cholesterol levels shot up. So if that happens again, she'll either put me back on statin, knowing that I didn't have any change with my symptoms of the autoimmune disease from being off of it. So she'll either put me back on it, or she'll put me on something else for my cholesterol. So, all right, let's see. Oh, you want the weight now, or do you want? Let's check my blood before I talk about the weight. So, again, here's my blood machine tester. Put that in. Just beep. Do, 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 do. Alcohol wipe. I seem to have the best results with the pinky. Get some blood. Gotta get some blood to that finger. I've been having trouble getting blood out of my fingers last few weeks. It's like my fingers don't have blood anymore. I got this here. There we go. I got some blood that time. Okay. Okay, I'm fasting. I just woke up and showered. Ooh, down to 80. I haven't had that low in a while. Last week it was 91. Week before was 85, and the week before that was 75. So went back down this week. So, all right. Now for the weight. I recorded myself on the weigh-in again, so here's my weigh-in. Looks like we're gonna call it 240. As you can see, I weighed in at 240. So the 2 weeks of weight loss due to being sick that resulted in me losing 9 pounds, I knew it couldn't last. But now I'm feeling better. My appetite did come back this week, and I did eat some bad stuff this week. So thankfully, I only gained 1 pound. Last week it was 239. That was another 4 pound weight loss to make a total of 9 pounds in 2 weeks. This week I went up 1 pound, so I gained 1 pound back. It was worse earlier in the week. Earlier in the week, I weigh in every day, but my official weigh-in for this is just on Saturday mornings. So, but I was going all the way up at one point a couple of days ago. I was at 243. So I'm glad it settled back down at the 240. Technically, I could have done 241. It was kind of going back and forth, but it landed closer to 240. So we're calling it 240, 1 pound weight gain. I'll take it, I guess, with all the crap I ate this week. Yeah. I didn't do any exercising this week again. I need to get back on that. So, but anyway, that's where that's. So on the 50 weeks of being back on Mounjaro while dealing with all these medical issues, I've gained 4 pounds. So, but I had lost a lot of weight before that. Like I said, when I started this journey of Mounjaro a few years ago, I went from a Mounjaro to Ozempic. I lost majority on Mounjaro initially. I was in like 305, got down all the way down to 210. And then I started having these issues of being tired all the time or whatnot, and I started gaining the weight back. Uh, I had to jump on Ozempic there for a while because I was initially on Mounjaro $25 coupon. That stopped working. They took that away. My insurance would not cover Mounjaro, but they would cover Ozempic. So I switched off Mounjaro, went to Ozempic. I didn't have success on Ozempic. The first few weeks was good because I think still had the remnants of Mounjaro in me, but after a few weeks, my body just didn't react to Ozempic like it does to Mounjaro. So thankfully, at the start of last year, my insurance company changed. Well, I still the same insurance company, but they changed policy where they started to approve Mounjaro. So I was able to go back on Mounjaro, thankfully. So I jumped back on Mounjaro, and that's 50 weeks ago. So that's where that's at. But then I started to develop issues. Uh, I was so close to being down to 210. I was so close to my goal weight of being under 200. Why did this autoimmune disease have to happen? That sucked. That really sucks. I was so close. Like I said, I'm at 240 now, so that's 30 pounds. That's 30 pounds higher uh, that I was at when I jumped back. When I had to jump to Ozempic. So yeah, that sucked. So, but anyway, it is what it is. I think all I got left for you is to take my Mounjaro shot. I'm on 7.5 dose. And most likely they won't have me take this next Saturday because they don't want you to take these within 7 days of surgery because of the effect on blood sugar. So, in all likelihood, they won't tell me not to take my shot next Saturday just as a precursor. So, but they have to tell me that first. So they'll call me up this next week to let me know medications, all this stuff to take, when to take it, when not to take it. But I'm 100% positive that they're going to say don't take the Mounjaro shot next Saturday because that will be just what 4 or 5 days before my surgery on the 19th, which is Wednesday. So, but anyway, here's the shot. If you've never seen it before, it has a protective cap. You take the protective cap off, you'll see the needle on the inside. You see the little medicine on there already. You'll want to move it to the unlocked position. You want to do it in your fatty part of your arm or your inner thigh or your belly. I always do the belly. So I'm not going to stand up. I'm just going to do this lying down today. Last week I did it on this side. I'll do this on this side. You're not going to be able to see probably the plunger going in, but you should be able to hear the click hopefully. You need to be at least 2 inches away from your belly button. So there we go. There's the second click. It came back up. And voila. They didn't even feel it that time. Sometimes you'll feel a little mosquito prick, but sometimes you don't. And I didn't feel it at all that time. So, all right, that's my update for you. I hope you enjoyed this update. If you would hit that like button, and if you're not already subscribed, go ahead and subscribe to my channel you'll get notification of future videos. I post once a week. Sometimes I'll post more. I might post once I see the primary doctor and get the update from her, the new blood work. I might make a midweek video to see where it's at, to see if that surgery is a go for the 19th. So I might not. We'll see. But all right, that's all I got for you. Y'all have a great weekend. Remember to enjoy life. Don't work yourself to death. It's not worth it. I used to do that, and look where it got me. So, all right, I love y'all, and we'll see you later.